Okay, guys, so this is Mobeen, and today we are preparing this lecture about the case reports. So, here, the report, let me show you the case report. Here is the case report that I'm working on. So, so hello everyone, how are you? So, this is really just me preparing for the evening lecture, and I thought I'll have tea and coffee with you. So, there is S here, Tina Col Coluccio. Coluccio. Tina been here. Where is all the cool beans? I just went live. So, hey Alicia, how are you? Bay Area Aquarius, hello. Margaret McInnes is here as well. So, I have this case studies. I think these are from Singapore. And the basic gist of these studies is that the researchers have found SARS-CoV-2 evidence of SARS-CoV-2 persistence even after 426 days of recovery or the first infection. 426 days, and SARS-CoV-2 persistence, not the broken material sitting here and there. So that's the interesting um, evidence. And both of those patients, one of them was immunocompromised. She had breast cancer, and because of that, they kept her immunosuppressed. So she had the virus for 165 or 75 days. And it can probably make sense that someone whose immune system is not responding very well, they may have it. However, for the rest, the other person, it's actually a case report of two people. The other person was not immunocompromised and they had it till 426 days. I'm going to put the link here in the comments as well. And it is 3:15. I got to be done by 5. So let's see. It's always a race against time. Blue says, I will have some thistle tea. Absolutely. Augie, how are you doing? Roller Girl is here. A very different audience is here. Mary Sturleys. Hi, Chief Bean and Cool Beans. Hello, how are you? Cynthia, Dr. Iron Mom. Hello. Patty Zig, Roller Girl, Ramnik, and Old School. Old School. Tina, Colocchio. Thank you very much. It feels like 101 degree. Oh man, it is so hot in here. Even with AC, I'm sweating. Wow, 112 in Sacramento. I have no idea what it is, but even Luffy, who likes to stay outside, he came back and is sleeping here. Roller girl, I've been able to catch you in the walk. Excellent. So much fun. Yes. Moose Lodge says, hello, Dr. Bean. I'm signed up for all your lectures. Thank you very much. And what you do not know yet, maybe you know it. I am creating on daily basis one more lecture that either I record before this or after this based on what time I have, which would start being uploaded from next week. And that is a series on microbiology. I think you would like it. And I hope that it's kind of cool as well that with a one time payment, there is a lot of value that keeps on coming in. Jane says it's cool here in Texas, 88. Ramnik says they say there's a dome of hot air, something I think I should work. Otherwise, my lecture will be missed. So, this is the basic case study that I'm working on. So, I was now going over the first case. So, this is a woman who presented on 7 March 2020, diagnosed with COVID, became recovered on 11 May. So 7 March, April, May, 11 May. So that long, and she was PCR negative. And maybe she just went there after a long time. Then a year later, on 4 May 2021, the patient presented with generalized abdominal loss of that. So once again, so that's where I am. 1 year later, and so I'm gonna, as you know, I keep a persona of the lecture separately. So 1 year later, what was the date on that year? So 1 year later, on May 4, 2021. May 4th, 2021, a year. So this was 426 days later. Okay, so what did she present with? A year later, the patient presented with generalized abdominal pain, loss of appetite, and nausea. So if I start from the top, so nausea, loss of appetite, generalized abdominal pain. So this is generalized abdominal pain with loss of appetite and nausea can be a sign of intestinal obstruction. So loss of intestinal obstruction or appendicitis. The patient has generalized pain, loss of appetite and nausea. Urgent expiratory laparotomy and appendectomy were performed. So what they did was they quickly opened up her stomach, her belly, abdomen, and they wanted to see if there is any problem in here. Plus, they removed her appendix. So laparotomy, urgent. So urgent. So they opened her abdomen. Urgent exploratory laparotomy and appendectomy, and okay. Today I'm drinking tea instead of coffee because yesterday I had taken so much coffee that I could not sleep till 2 o'clock in the morning. So today it's tea time. All right. So they did that. And what happened? Urgent. performed the tissue histology showed reactive lymphoid hyperplasia. Okay, so they did this. Let me give her some shade. Okay, so there was lymphoid hyperplasia. A biopsy of the skin of the lower limb was also obtained, and the patient was diagnosed with superficial and deep perivascular dermatitis. So, a lower limb, lower limb skin biopsy, lower limb skin biopsy. So, what did they observe? They observed that number one, she had lymphoid hyperplasia, which means the lymphoid tissue. I'm thinking this is the gastrointestinal hyperplasia. Um, did I misspell appendectomy? Appendectomy. Actually, let me just. Software is so weird, but it is so good as well because of the infinite canvas. Appendectomy. Appendectomy. Okay, I think it is corrected now. Okay, so lymphoid hyperplasia was observed. That must be in the GIT tissue that they took, for example, appendix. Then diagnosed with superficial and deep perivascular dermatitis. Number two, superficial. This actually tells me superficial and deep perivascular around the blood vessel, perivascular dermatitis, skin inflammation around the blood vessels. Now, this has been a common complaint with COVID or even with vaccine to have skin burning and skin itching and skin issues. And this seems to be, at least in this case report, that this may be because of the perivascular dermatitis or lymphoid tissue. So imagine this is a blood vessel. The lymph macrophages and neutrophils and others, the immune cells come out of the blood vessels, and as soon as they come out, they attack the cells. The what are we talking about? We're talking about skin. So they attack the skin cells. So right next to blood vessels, there will be skin inflammation because the armies of the immune system are getting out of the blood vessel and attacking whoever is standing next door. And who is standing next door? The skin cells. So the skin away from the blood vessels is better, but the skin immediately next to the blood vessels, is really feeling bad. So that is the perivascular dermatitis, a high level depiction of perivascular dermatitis. Okay, then before the procedure, the patient had a negative PCR test result for SARS-CoV-2. So patient was was PCR negative. Raghav says, what is the data on the universal flu shot looking like? That's an interesting question, Raghav. I haven't looked it up. I will I will check it out. That's my mother-in-law had initially, Alicia says, and she was given a steroid for it, itchy skin. Yeah. So it can be, so inflammation can be because of histamine, or here in this case, it seems like it is lymphoid immune system cell mediated issue. Before the procedure, that's fine. Then they have this table one. Okay, so now we have the table one. This was 4/9/2020 is this is the situation, and 6/5/2021 here. Okay, so then what happened next? I need to do one more report. How long is this one? Okay, 2 paragraphs. The patient's appendix and skin tissue were obtained 426 days after the initial symptoms. Using multiplex immunochemistry, SARS-CoV-2 nucleocapsid protein and spike protein were detected in the appendix. Okay, so that's very interesting. SARS-CoV-2 nucleoprotein. So in the appendix co-localized with myeloid and macrophage markers. So in the appendix, if I make this was the resected appendix. And they took the cells from it. So this was appendix. And they found the SARS-CoV-2 were detected. So SARS-CoV-2 nucleocapsid protein. So nucleocapsid protein. So that is, remember, if this is SARS-CoV-2, and it has, this is the RNA, then we know that it has these nucleocapsid proteins that are kind of protecting the genetic material. It's kind of a coating for it. And then let's give it some spike proteins. So they had nucleocapsid proteins. The presence of the nucleocapsid proteins is actually a good indicator of the SARS-CoV-2. So we detected appendix co-localized with myeloid and macrophage markers CD64, 14, 206, and 69. So then they also saw that the macrophages here, these macrophages are a little sad. Why they're sad? Because it seems like this so which markers were there? CD68, which is macrophage, CD68, 14, 206 and 167, CD206 and CD 169. 169. So the spike protein, the nucleocapsid protein, was present or co-localized with these markers, which means, according to the author, so I have read this a couple of times now, according to the authors, this means that SARS-CoV-2 was actually attacking the the immune system cells. So these findings support a prior investigation in which residual viral antigens were consistently detected in the GIT, co-localized in ACE2 CD68 cells. So ACE2 CD68, are these the macrophages or dendritic cells? So CD68 positive cells. These are clusters is monocytes. These are monocytes. Remember Dr. Bruce Patterson's work? So previous study, previous study. So I believe showed. So I believe that at some point Dr. Patterson's work has to be reviewed or revised to say that this may actually be active virus. They haven't found any evidence for that, but here this group has been releasing studies with the evidence for the persistent virus. So previous study showed ACE2 positive, CD68 positive cells with with residual viral antigens, with residual viral antigens. So these guys are monocytes. So for your this evening's reading pleasure, I will highlight some of the things. Augie says, would ghost cells be subject to autophagy? Uh, Augie, those cells, yes, yes. Actually these cells are even more subject to autophagy because immune cells are replenishing all the time, 4 or 5 days. So if they are hanging out there, they want to die because it is not their life to live on for a long time like monocytes living on for 1 year. So as soon as we do autophagy or things like that, that can help these cells clear out. I feel, and now this can get my this account decimated by YouTube. I feel that things like ivermectin can actually help with the with clearing these two. Okay, so this is the virus, and here we are. So this they have. So you could dismiss this whole discussion by saying, you know what, these are just two people. But the same group actually released previous reports as well of showing or demonstrating the evidence of SARS-CoV-2. And they believe another important thing, which I had already done before we came live. They believe that the GIT is the reservoir from where the virus just keeps spreading or going to the body after finding a place to live in GIT. So let's keep going. So abdominal pain lost this diagnosis 26 days later. Those findings support our previous. Interestingly, viral nuclear protein was also detected in skin macrophages. That is so bad. So then they also, I should say, oh wow, that's a cool color. Why? Appendix. Then in macrophages. If I make a macrophage, what time is it? 3:38. I think I can do the other in another hour or hour and a half. Skin macrophage. Maybe I should take a picture of these guys because next case study. Okay, so what are these little structures? Who would tell me? What are these little dangly structures? Okay, so this is a skin macrophage. And they found in skin macrophage, the nuclear protein. This is really bad in the sense that it shouldn't be happening like this. Fortunately, we know how to handle these and remove them by autophagy and IVM like things. But still, so these are NP proteins. Hmm. So in this woman, she had the GIT symptoms. Appendix is a part of GIT. So she had the evidence of SARS-CoV-2 in her appendix attacking the immune cells there. Plus, she had the evidence of SARS-CoV-2 inside the macrophages in the skin. That tells us why the skin symptoms appear, because the macrophages themselves are infected. That also means the Dr. Paul Marik used to say that, hey, this is a macrophage activation syndrome. It is possible that macrophages in the skin are also causing the dysregulation, which in turn cause them to cause damage to skin. So they found this as well. Specificity of the used antibody was reported. So then they have this figure 1, residual SARS-CoV-2 detected in the appendix and skin tissue of patient 1 using multiplex immunochemistry and RNA scope. A and D representative images of the A appendix and D skin. Okay, so A appendix and D skin. So these all dotty cells are probably the monocytes or immune cells. Skin tissues stained with hematoxylin and eosin with differential staining of nuclear hematoxylin and cytoplasmic eosin components. B and E representative images of the appendix and skin tissue. B and E. B, E. So this is skin tissue. DAPI are the markers. CD68 is the monocytes, and this is the COVID NP. And if you go here, what they're showing is inside the monocyte, the nuclear proteins are sitting. This is what they're showing. Interesting. And what is in E? In E, they are saying skin tissue stained with DAPI and CKEPCAM red, CD45 cyan, SARS-CoV-2 nucleocapsid protein green. So DAPI, this CD45 green is in this. So this is the nuclear protein. So if you combine, and CD68 monocytes. So if you combine them all, this is all around the monocytes. This is all. So that is a co-location of the nuclear protein. So the virus is sitting in these places, or was sitting in these places. Very interesting. So skin and the appendix, they both had markers of showing nucleocapsid proteins 426 days later. Okay, so then let's continue. Having established the presence of the residual viral antigen in the appendix and skin tissue, we then aim to assess its genomic presence. So they wanted to see, was it present with its genetic material, or just the raw damaged debris was present. So lots of questions. Yes, of course, it can cause small fiber neuropathy, and it can cause nerve damage. It can cause nerve inflammation, because right under the skin, all this is happening. Megamucil HPV, yes. Would this lead to tags in the skin? It could, because now that we have an inflammatory state of the skin, what does that finally, what is a person's body habitus, or the habitus of the skin? What are the viruses sitting there under the skin, near the skin, on the skin? That would depend how the people would respond to this. Absolutely. So KC says, could activated skin macrophages induce purpura? So purpura is when there is bleeding. And so if you see here in the first case report, they are seeing the um, perivascular inflammation or dermatitis. If that is happening, then even the blood vessels will start getting damaged as well. And that would give rise to purpura. So, yes. Yes. So, Megamuzi, this was 426 days after the previous infection. Colombian Bean says, this is cool. Love seeing how the doctor preps. Yes, it's quite a lot of work. Alicia says, oh boy, this explains why my mother in law is still battling weird symptoms. Hyperbaric oxygen has helped her a little bit. You're very welcome. Amos says, this is my first time entering a KoolBeens live chat. Are the questions to Dr. Bean supposed to be specific to the lecture prep, or can they be anything? You can ask anything, but if it is lecture prep, it can help me with the prep. But I hope I can answer the questions. Yeah, so purpura, I mean, if just we're talking about the skin color changes, and that's fine. Purpura is usually bleeding under the skin that just keeps happening. Colombian says, excuse me, immune mediated thrombocytopenia. So when there will be a lot of activation for thrombocytes, that is platelets, and then the remember platelet factor 4 activation by the vaccine and the SARS-CoV-2, that can eventually cause thrombocytopenia. So first there is increased thrombosis or clot formation. Then when the platelets are adsorbed in those clots and they are just picked up, then there is less platelets. So Mo says, did you end up finding any answers on severity of the first infection in immune naive individuals today, for example, as you intended in your 715 Khatri study lecture? Yes, so I saw some studies, but so I have some studies collected. I just am not sure how to assess the severity for the first infection because the data presented does not present the cohort characteristics very well. The comorbidities are not there. So I have some data, even from Qatar. So, Mary, this is not correct. This is just a rumor because Dr. Flavio Codignon, or if I pronounce his name correctly, has on 5th, I believe on 30th August, they published a study on ivermectin that it worked. That started this rumor. Somebody said NIH has the ivermectin on the list of COVID. So NIH actually has the list of COVID therapies with ivermectin in it for 2 years, but they also say don't use it. We only recommend it for the studies purposes. And so that just rumor started, and once again, it's all over the place. Maybe Gon says, isn't chit chat after the lecture? Yes, but I have been doing the tea times or coffee times together. I hope it's okay. So I need to do some more drawings. So give me 1 second. I'll come back. All right. So having established the presence of the residual viral antigen in the appendix and skin, we then aim to assess its genomic presence. So they wanted to see if the genetic using RNA scope in situ hybridization, we detected viral RNA within both extracellular and intracellular spaces. That's so bad. Figure 1G. And so please don't mind me making these expressions. That is so bad. That is so. This is how I prepare a lecture. I talk to myself and I say, oh man, this is so bad. Or, oh, this is good. So these are just my expressions to myself. So figure 1G and 1H. Figure 1G and 1H. So here, this and this. Wow, these are the markers of the nucleocapsid, correct? RNA, actually RNA. These are the markers of RNA inside the cells. Oh, it's 426 days later, the RNA was in the tissue and outside the tissue. So here, this seems to be outside the tissues and this seems to be inside the tissues. Okay, so this is a big one. So then the question became, what about SARS-CoV-2 RNA? That became the question. So they are saying that in the cells, so what cells are these? of the appendix So these are appendicular cells, appendix cells. So this may be a cluster of the appendix lymphoid tissue. So if I go back here, imagine these are some monocytes, macrophages. There's a tiny little one over here. There's another little one here. And so then there are some here. And then, so I intentionally am making some intercellular spaces to show RNA. Okay. So we have the little cells. First, let's make them all crying cells. Why? Because they're infected. They are not happy cells. I always make one cell smiley, at least, while others are kind of sad. Okay, so these are the cells, and in these cells is the and outside the cells is the viral RNA. RNA detected inside intracellular, inside the cells and outside the cells, interstitial tissue outside these cells. This is not a very good thing. Especially 426 days later. That is a problem. So this is done as well. So the appendix, the specificity, this technique was not performed on the skin tissue due to limited tissue availability. The specificity of the used probe was tested on normal colon tissue. Okay, so they're saying that, hey, we know it works because in 2018 we have used this immune chemistry technique on normal tissues, and it can successfully indicate when it is normal. So what they're saying is that it is showing abnormality, and that is a correct result. It's not a fluke or tests failure. Okay, so this is the end of report, case report one. Roller girl says, just said to myself, that is a problem. Then you said, Dr. Bean, yes. So Melissa says, my legs, ankles became swollen for several weeks, was eventually able to get circulation back on track. Lots of forced walking. Yeah. So that is so many things wrong. For example, vasculitis, dermatitis, uh, clotting, thrombosis. Why is somebody calling me? Okay, so Casey says, I missed why Dr. Bean not allowed to visit because I caught SARS-CoV-2, the COVID twice from Starbucks. So I am done with the Starbucks. I have to take tea or coffee at home. I have been captured. Roller Girl says, I have your phrase in my mind. Yes. Okay, so this is one case. Now I'm going to go to the case two. Give me 1 second, quick break, and then we start. Amos says, any thoughts on regular use of iota lota carrageenan? Very good spray. I actually think that povidone iodine is very good as well, but carrageenan, I have done a study presentation that it is good as well. Yes, I am grounded, Mary. Correct. S says, if you're liking, enjoying this, then give Dr. Bean a like. Yes, like and subscribe and share and buy the Dr. Bean plans. Julian says, hello, I can't remember how I got here. You went to YouTube and then you got attracted to Dr. Bean's channel. So, one quick second, and I'll be back and we'll work on the second report. Kizzy says, so sad for you. Yes. Okay. And everyone who is here, please feel free to take care of whatever else you are doing. Thank you for your company. And Julian says, I think it's time for me to learn what's new with SARS-CoV-2. Yes. So I think this is an important concept to kind of finally agree on, that SARS-CoV-2 persists in the tissues in some people. Okay, second case. So patient 2, 45-year-old woman with ductal carcinoma in situ presented with acute symptoms. Okay, so let's start writing her. I had made her in red color. So then Case report number 2. Now this person, I made her red just for the so I still do not know how to make draw breasts, so I just copied them to learn at some point. I think this is good enough. She's 45 years old, 45 years of age, um, ductal carcinoma patient, and hence she is immunosuppressed. Okay, so presented with acute symptoms, intensive headache, upper stomach pain, nausea, diarrhea, myalgias, and fatigue. So, what was this? 14th March 2020. Excuse me. So, 14th March 2020. So, she presented with here. This isn't the best software, but I like its infinite canvas. So now on this side, I can write her symptoms. Intensive headache. So intense headache. I do not know if intensive headache is a term, maybe a translation issue. Intense headache. Um, upper stomach pain. Upper stomach, what is that pain? Upper stomach, probably esophageal reflux stomach pain. So I'll make here upper stomach pain, diarrhea, nausea, diarrhea, myalgias and fatigue. So generalized myalgias and fatigue. She was fatigued. I should have drawn her a little slouchy, but I can't change that. She's standing totally as if she doesn't have myalgias. Okay, so these are the presenting complaints. This was on 14th March. Okay, so that is her situation. How is everyone doing here? Casey says, Dr. Bean, they are just two half domes. So draw and shape them the same way. So two half dome. But the question becomes, so let's say this is a half dome and then this is another. These don't really look like breasts. I think it's like this from the front, and then probably something like this from the side. But the problem is I can draw them like this from my anatomy days. I do not know how to put them correctly in a figure. But thank you for helpful hint, Casey. Okay. Robin says your woman is great. Yes, I copied it. All right. So nausea, stomach pain, diarrhea, March 2020, and was diagnosed with PCR, COVID. So became COVID positive, PCR positive. So when I say that she becomes PCR positive with COVID, then people would write comments. PCR is not the correct one. 44 years, ductal carcinoma patient. So that is her situation. Now, what is next? Over the next 2 months, the patient reported that several of her symptoms worsened. On 8 May 2020, the patient received her first negative. So, symptoms worsened 2 months. So, this is a for 2 months. So, this is also a sign of long COVID, that the symptoms continue and worsen beyond a couple of weeks. So symptoms worsened for 2 months. 8 May. So I'll make it in green. 8 May 2020. 2020. PCR negative. So according to the PCR, she became okay. Casey says, well, they are hard to get wrong since they come in all sizes and shapes, not an idealized stereotype. That is correct. You are correct, Casey. I think so. Let me tell you one more reason I am not very much sure how to draw them. So let's say if I'm drawing a woman, and let's say, so my first challenge is for a normal uh, other body, let's say a man's body, I just make these straight lines. So now the first question is, where will the breasts go? So let's say if they go here and here, then the second question is the arms. So imagine this is the breast. So now are the arms behind the breasts like this, or they are in front like this? So I just have to kind of observe other artists' work to figure it out. Just um, more knowledge. Okay, so over the next 2 months, the patient reported that several of her symptoms worsened. On 8 May, she became fine, although the symptoms persisted. So once again, she also had symptoms. They both had this, symptoms persisted. On 12th August 2020, so May, June, July, August 2020, and 1 September 2020, the patient underwent partial breast resection and margin control surgery, respectively. So they were managing her for cancer. So 12 August, 12 August 2020, and 1st September 2020, she had partial breast resection, and margin control surgery. Partial breast resection. So that also gave them the breast tissue to look into. Partial breast resection and margin control surgery. Before the procedure, the patient underwent preoperative PCR testing and received a negative test. So she was here again, was PCR negative. Okay. So on these dates, so you can quickly glance at them. This is what happened. Ramnik says the cross section of spinal cord sometimes looks like a woman too. So cross sections, if I make Margaret just called me. I hope you can hear me. Is my audio not working? So Ramnik, so let's say this is the spinal cord. This is gray matter. I'm gonna make this in white, in blue. This is the white matter. So Ramnik, where so Krista is here. Hey Krista. Okay, I'm gonna continue. I need to draw. So she became PCR positive before the now breast tissue was obtained from the patient 175 days after the symptoms onset. So this was 175 days after the onset of initial infection. And now I'm sure that they're going to say, you know what, this breast tissue had the virus. Luffy, what are you up to? So Luffy decided to go out. It's going to be really hot for him. Okay, so breast tissue was obtained 175 days after. With the same technique for patient 1, viral NP and spike protein were detected and observed in the tumor adjacent areas, figure 2A and B. So this was first patient. This is figure, I'm hoping this is figure 1. Let's see figure 2. G002. Okay, so G002, this is A. And if you see here, the same pattern that we have the, excuse me, CD68 that are monocytes, CD45, I believe, macrophages, and then COVID nuclear protein, DAPI are the markers. And if you put them all together, here are the proteins. It seems like inside and outside. So here, extracellular, what is it? Inside the cell. It seems like a little bluish. This is inside the cell. So it is outside the cell and inside the cell in the breast tissue. So these blobs of clear cells are probably breast's fatty part or fatty tissue, and these are the glandular tissues. Okay, so let's see. Viral RNA, the viral antigens, let's see. Tumor adjacent areas. So if I go here to draw, so imagine these are tumor cells. They are whatever shape they want to be, angry, disobedient cells. Okay, so these are the tumor cells. All right. Now, adjacent to the tumor cells, the virus and NP and spike protein were detected, and spike protein were observed in the tumor adjacent areas. So here, adjacent, and this is tumor. They saw the virus spike, and the nucleocapsid protein that is inside. So this showed them. So NP and spike proteins. That's one finding. The viral antigen also co-localized with the myeloid and macrophage markers CD68, 206, and CD169. So here, if I made these seems to be cells that will be in trouble, immune cells and myeloid cells, monocytes, etc., and the macrophages. So CD, what were these markers? 68 monocyte, 14, 206, and 69. 68, 14, 206, 169. So these cells co-located with these cells. This is what they observed. more in the center. And viral RNA was also detected in the breast within both the extracellular space of the tissue and within the cells. So that's what I think I was seeing here. This is extracellular tissue, and this is within the cells. So I should just write it. RNA also detected within the cells and extracellular tissue. Okay, so that's done. The specificity of the extracellular tissue within the cells, done. Okay, done, done. 425, 424, we are done. Okay, so anything in the discussion? A growing body of the evidence, also suggests that and supports the possibility that the GIT may serve as a SARS-CoV-2 reservoir in both convalescent and long COVID patients. This, I think, in this whole discussion today, this is the most important statement, because the question is, where does the virus live? Okay. I want to then, to iterate this, I'm going to put the screenshot. Let me take the screenshot of this part. One last thing, and then we will be home free. Import image. So this is, so they're saying, nevertheless, we believe that these two cases are first to report detected viral antigen and or RNA in the tissue of patient with long COVID. Despite the lack of definitive consensus on the underlying pathophysiology of long COVID, emerging evidence suggests that LC is associated. So, emerging evidence suggests that LC is associated with gut dysbiosis. This is very important. And the aberrant immune activation in response to residual virus. A growing body of evidence also suggests and supports the possibility that GIT tract, gastrointestinal tract, may serve as a SARS-CoV-2 reservoir in both the convalescent and long COVID. This is it. Evidence. So gut dysbiosis is very important as well. Okay. Hey Parth, how are you? Guy says if a leg bone breaks, can CSF leak out? Does CSF in spine volume reduce if a leg bone breaks? No. So it depends. If the hip bone breaks, then hip bone is attached with the sacrum, which is then very near and attached with the spinal cord. So if the fractures go all the way there, then that's different. But it has to be spinal cord. The leg bone, for example, femur or tibia or fibula or the bones of the foot, they will not do anything. Melissa says, I greatly appreciate your attention. Details, you all have helped so much. Yes. That is my clickbait title. What is the title? Tell me. I want a clickbait title. So, ideally, old school, the fecal test should be done to kind of detect the virus. Cold tea. Correct. So, virus finds a safe harbor. It lives in the GIT. Yes. Margaret says, congratulations. Thank you, Margaret. Julian says, does this mean that the immune system cannot fight a virus in a cancer? I think cancer itself depends. If it is a cancer of the lymphoid tissue, then yes. Mostly during the cancer, when the patient is given chemo or kept uh, immune suppressed, then depending upon the intensity of suppression, they may or may not be able to handle infection. Luffy went down and is meowing. Okay, so let's take a break and we'll see each other in about half an hour once more on the other channel. Thank you very much for having tea and coffee with me and being here. So please, what is the title? When the RNA won't go away, long COVID. That's a good one. Or should we say, I had made the title, which I thought would be attractive: Skin, Breast, and Gut Have SARS-CoV-2 for more than a year. What do you think? I'm okay with when the RNA won't go away, long COVID. That's a good one too. Cool. So, with this, thank you very much. I will see you in a few minutes on the other side. Bye bye. Other channel.